Hello, everyone, and welcome to It's Not You, It's Your Hormones. My name is Ann Lemons. I'm a functional medicine, nutrition, and lifestyle practitioner. And today we're going to explore how hormones are sabotaging your efforts to feel vibrant and live your best life. So, this was me about 15 years ago. I was struggling to get out of bed in the morning and get through the day. I had significant digestive issues and body pain, and yet all of my tests and labs were normal. In addition to the conventional tests and treatments, I tried many different types of alternative therapies, detoxes, and diets. I was prescribed medication and diet advice, which didn't help and really just made my symptoms worse. I decided to go another route and look into what functional medicine had to offer. I loved the philosophy of a root cause approach. It just made sense to me. I went to a well known functional medicine clinic and did some specialized functional testing. And now they did find several things that needed to be addressed. So I thought, great, finally, I've found the answer. But the new supplements and recommendations they suggested for me did not really change my symptoms at all. In fact, I was still chasing symptoms, only this time with supplements instead of medications. I was so frustrated and confused. I'd spent all this time and money and still didn't feel better. My instincts were telling me that the answers were somewhere in the functional medicine realm. I just didn't have the right practitioners or the one that knew how to truly work functionally and methodically to get to root cause or causes. I decided to become my own healer and became certified in functional medicine, nutrition, and lifestyle medicine. And it was through this work and getting some specialized testing done for cortisol levels that I discovered I had adrenal fatigue or HPA axis dysregulation. And a certain type of breath test revealed a massive bacterial overgrowth in my gut. As I started addressing these roots, working to balance my gut and adrenal glands, I began to heal. And it made me a firm believer in functional medicine, but also helped me to understand that there are different types of functional approaches out there. And the one that worked for me and the one that I use with my patients is a consistent, methodical approach that includes personalized nutrition and lifestyle change, along with lab testing and targeted supplementation. I knew there had to be a lot of other people out there with chronic symptoms that were experiencing the same problems and being dismissed or told it's all in your head or there's nothing more that we can offer. Conventional medicine is incredibly effective for acute issues, but often falls short for the chronic diseases and issues. And it's looking at what is wrong, but not exploring why it showed up in the first place. It's matching symptoms to a diagnosis and treated with a protocol. It's more of a one-size-fits-all approach versus a bio-individual approach. And conventional medicine is not looking at the terrain in which your condition showed up and addressing that. In other words, what does your diet look like? What do stress and sleep look like? What about your relationships and support systems? All these things matter, and they have to be addressed for root cause resolution to be effective. I know how frustrating and hopeless this can feel. This is why I want to help you avoid chasing symptoms with ineffective strategies that are physically and financially draining. I want to help you get to the root cause or causes of your symptoms. I want to empower you with the tools to create a balanced internal and external terrain that help to restore your body's innate healing potential. In the next 30 minutes or so, you'll discover how hormone imbalance may be sabotaging your health goals and why bioindividuality matters. We'll showcase 3 different patients with some similar symptoms and even root causes, but different approaches. You'll understand 3 key aspects of hormone balance so that you can move through perimenopause with more vitality and purpose. If you're new to perimenopause, you'll appreciate understanding how much blood sugar imbalance affects symptoms like fatigue, hot flashes, night sweats, and weight gain. In the second example, you'll see that even if you've already done some cleanup work in your own, in terms of your diet, how much an imbalance in gut bacteria and detoxification issues can contribute to weight gain, PMS, migraines, skin issues, and low libido. In the last example, you'll see that even if you think you already know everything there is to know about weight loss, nutrition, and exercise, and have seen many providers and done everything, you may learn something new when we cover underlying infections and the mind-body connection as root causes to resistant weight loss, fatigue, and heartburn. So let's start with blood sugar balance. Blood sugar balance is the foundation for all hormonal and mental health. And by mastering this, you can help manage female hormone symptoms like PMS, night sweats, hot flashes, weight gain, and mood swings. So meet our first patient, Jennifer. Jennifer is a 58-year-old woman who came to me more than 20 pounds overweight, with most of that weight around her midsection. She complained of fatigue, night sweats, and digestive issues, and she had high blood pressure. Her doctor had given her an antidepressant for the night sweats, but this wasn't helping her at all. Her gallbladder had been removed 3 years previously, and since then, she experienced constant bloating and stomach pain. She also complained of seasonal allergies. Her diet was less than ideal. She relied more on processed and packaged foods and was picking up fast food on her way home from work because she was too tired to shop and cook. She didn't have enough high-quality protein, good fats, or fiber in most of her meals. What Jennifer didn't realize is that her food choices and meal composition were causing inflammation, digestive distress, and blood sugar imbalance, leading to her symptoms. It was making it hard for her to lose weight with little energy left at the end of the day to work out or play with her grandkids. The off-label use of an antidepressant for the night sweats was just a Band-Aid and not working on the cause of her symptoms. The gallbladder removal made it difficult and uncomfortable for her to break down and absorb her fats. And gallbladder issues are often a sign that estrogen and progesterone, the female sex hormones, are out of balance. Let's spend a moment or two in the physiology of what's happening with Jennifer's hormones. This graph represents the blood sugar swings that can happen when eating more quick carbs, processed or sugary foods. And when we eat these foods, it creates a spike in blood sugar. This causes a big release of insulin, which pulls sugar into the cell to use it as energy. This results in a blood sugar crash, leaving us tired, depressed, anxious, and moody. And to bring the sugar up again, the body releases this hormone, cortisol, which is a stress hormone. And this up and down cycle continues on. And over time, this leads to weight gain, fatigue, female hormone issues, mood issues, and other chronic disease. And when we have excess amounts of insulin and cortisol, it causes us to store fat instead of burn fat, especially around the midsection. So you can see it's not you, it's your hormones. And the place to start balancing them is with your blood sugar. To make matters worse, this blood sugar that's swinging high and low triggers the release of stress hormones like cortisol and adrenaline and noradrenaline. And this impacts and inhibits the messaging signals from the brain to the sex organs to make hormones and keep them balanced. Female hormone imbalance and the symptoms associated with that, like hot flashes and night sweats, are just a downstream issue from an upstream problem, in this case, blood sugar imbalance. And by the way, this is why bringing in hormonal replacement therapy before addressing blood sugar may not get you the results you're looking for. Can you see that? Blood sugar imbalance inhibits the messages to create balanced progesterone and estrogen. What did we do for Jennifer? Well, we optimized her digestion from top to bottom, which rid her of her stomach pain and improved her ability to absorb fats and nutrients. We changed her diet to include more whole foods and eliminated the foods she was sensitive to, taught her basic cooking skills and how to batch cook for healthier eating during the week. We taught her how to eat to balance blood sugar through the day. We started her on targeted supplements to support the gallbladder and digestive tract and help lower inflammation. We were able to use recent blood work to guide our treatment plan without the need for any specialized testing. How is Jennifer now? All of her symptoms have cleared up. She no longer complains of night sweats. She sleeps soundly through the night. She has no digestive issues, and her blood pressure normalized so that she was able to completely come off of the antidepressant and her blood pressure medication. She lost all of her weight and is now the same weight as she was before having children. She restarted an exercise program and has the energy to play more with her grandkids. And as a bonus, her seasonal allergies disappeared. She is living vitally. Moving into our second case and causes for hormonal imbalance, we're going to talk about underlying gut and liver detoxification issues as root causes to symptoms. So meet Sarah. She was proactive in her health. She was already eating healthy and even started working with a nutritionist. She came to me because she wanted to get off the birth control pill as it was causing a skin condition on her face called melasma, a brown pigmentation that was concerning to her. She also had acne, psoriasis, and migraine headaches since high school. She continually experienced stomach pain and bloating and complained of breast tenderness, water retention, and mood swings before her period, not to mention that her libido was also in the tank. What Sarah didn't realize is that hormonal birth control doesn't fix underlying hormonal issues, it just masks them. And it may lead to gut bacterial imbalance and intestinal permeability or leaky gut. This means that things like food particles, toxins, and bacteria, which should pass through and out of the body, instead leak through the gut wall and into the systemic circulation, causing inflammation. Now, this inflammation can show up on the skin, cause migraine, headaches, and be a trigger for autoimmune diseases like psoriasis. Poor gut health, lack of certain foods in her diet, and sleep issues were also contributing to high levels of estrogen in the body in comparison to her progesterone levels. This hormonal imbalance, in addition to food sensitivities, were also contributing to her migraine headaches. Let's take a closer look at leaky gut or intestinal permeability. Here we have the gut wall, and you can see it's only one cell thick. The cells are held together by something called tight junctions, and these tight junctions can come apart from certain stressors. You can see here that there are many things that can cause the gut to become more permeable or leaky, like stress, toxins, undigested food particles, or medications, like in Sarah's case with hormonal birth control. Again, when the gut becomes leaky, all the things that should stay inside the digestive tract instead leak through the intestinal wall and trigger an immune response, which causes inflammation and all kinds of symptoms. So here you can see all the different organs and ways a leaky gut causes symptoms, from the gut to the skin, the thyroid, the sinuses, the joints, and the brain. For Sarah, we used standard blood work, but we also did some hormone testing, which showed that Sarah wasn't detoxifying her estrogen very well. And this left her in an estrogen dominant state. So in her case, her estrogen levels were much higher than her progesterone levels because she wasn't getting rid of her estrogen. She was preferring a very inflammatory pathway to metabolize her estrogen, this 4-OH or 4-hydroxy pathway, can not only cause symptoms, but can damage the DNA, and we don't want that. This is considered phase 1 detoxification. She also wasn't methylating well, which is the second phase of detoxification for estrogen. Both of these detox pathways were clogged up, and this was contributing to her symptoms of migraines, PMS, and weight loss resistance. So here's Sarah's plan. Before we could even start coming off of the birth control, we needed to back up and work on cleaning up the gut and balancing her hormones first. A simple at-home test revealed low stomach acid. We worked on digestion from top to bottom, similar to what we did with Jennifer, and included things to increase her stomach acid and digestive enzymes, along with probiotics and foods to help increase her good gut bacteria, and supplementation to help heal her leaky gut. We brought in nutrient-dense foods to support blood sugar, more targeted supplements to replace some of the nutrients depleted with the birth control pill, in her case, magnesium, B vitamins, and zinc. We incorporated healthy lifestyle techniques with specific foods, spices, and supplements to support the liver and allow it to work more efficiently to lower her estrogen levels. How is Sarah now? As we started working through the layers with Sarah, bringing her hormones into better balance and optimizing her digestion and detoxification pathways, her symptoms began to fall away. She's now off of birth control, migraine-free, digestion is running smoothly, and best of all, her psoriasis, acne, and melasma are under control. If she gets off track with her clean eating and lifestyle, she is now empowered with the tools to bring herself back to baseline. She's excited to report that even her libido has started to come back online. Now we're going to take a look at how underlying infections and stress were root causes of some stubborn symptoms that didn't respond to any therapies. Here's Donna with resistant weight loss, fatigue, and heartburn. She had seen many specialists, including naturopaths, acupuncturists, nutritionists, chiropractors, and was currently working with a functional MD. She had spent thousands on supplements, testing, and therapies, and tried every kind of diet. She had a clean diet and lifestyle, and she was doing all the right things, but she had weight gain that just wouldn't budge. She suffered from hot flashes, exhaustion, heartburn, constipation, and anxiety. She'd been through a divorce 10 years earlier and felt depleted and frustrated by all the work she had done, money spent, and still didn't feel better. What Donna didn't realize was how much her highly stressed state, the stress of her divorce, the lack of sleep, and overexercise without enough nutritional support, had exhausted her adrenal glands and was starting to affect her thyroid, which made it difficult to lose weight and left her more vulnerable to picking up a gut infection. She had subscribed to the theory that she just needed to exercise more, eat less, and didn't realize that she was actually creating more inflammation, leading to her symptoms. Let's take a quick look at what happens to cortisol levels when we're under long-term stress. In the beginning, as we're dealing with high emotional stressors like lack of sleep and overexercise, cortisol levels go up to handle the energy needs, and DHEA levels, which help to balance cortisol, may start to lower. This is located in that second section here, and this is what we would call a stage 1 adrenal fatigue or HPA axis dysregulation. You may feel tired but wired in this stage. You may start craving caffeine or sugar to keep you going. It's like having your foot on the gas pedal even when you're at a stoplight. You eventually start to burn out the adrenals and then can move to a stage 2 where cortisol levels are a little bit lower than they should be, but DHEA is noticeably lower. Energy and motivation may be less, and physical symptoms start to show up like weight gain and digestive problems. And after several years without intervention, although some people can stay in these stages for some time, you can then move to a stage 3 where Donna was. And this is where cortisol levels and DHEA levels are much, much lower. You feel exhausted, find it difficult to get out of bed in the morning, sleep is non-refreshing, and symptoms like weight gain and digestive issues become much harder to manage. There are different approaches for all of these stages. This picture shows the adrenal glands in the middle and all the different body systems they influence. The adrenals influence everything from weight loss and inflammation to immune health, brain, bone, mood, sleep, and hormonal health. Emotional and physical stressors like getting a divorce, lack of sleep, over or under exercising affects the adrenal glands, which have repercussions throughout the entire body. So how did we help Donna? We needed to address the fact that she was still processing the end of her marriage. She started to go to therapy, and we explored more ways to manage stress, found the things that brought her joy with ways to expand her community support, which were all lacking in her present plan. We worked on sleep hygiene and developed a consistent night routine. Instead of spin and CrossFit type classes and exercise, we started to do more gentle yoga and walking, which were much more appropriate to support her exhausted adrenals. We brought in more whole foods, including hormone balancing foods, eliminated inflammatory foods with some targeted supplementation to support the adrenal glands. With specialized testing, we found an underlying gut infection that was also causing the heartburn and consequently taxing her adrenals. We were able to treat it, then restore and heal the gut lining. We were able to build a bridge with her functional medicine MD so that she felt equipped at each and every appointment to ask the right questions and get the most from her doctor. After working through each of these layers consistently and methodically and with the support of a true team effort, Donna's energy gradually returned and she was able to release the excess weight. Her hot flashes are greatly diminished, the heartburn is gone, and she feels much calmer and at ease. She feels like she's finally coming into her own. What we found with these women is that healing could only occur when we were able to uncover root causes and understand how to shift the terrain where these root causes were occurring with individualized nutrition and lifestyle plans, a little bit of testing and supplementation. So my question is, are you ready to move forward from your hormonal symptoms? What is your present plan? Here's the problem. There is so much information out there and it's coming at you from every angle. Social media, Google, health summits, and your neighbor or best friend who always seem to have the answer. All this information is confusing and it doesn't take into consideration what's right for you and your body. If you're not working with your bioindividuality, it means you may not be working with what's right for you in terms of your diet, supplementation, and lifestyle, because it doesn't take into consideration your unique history, genetics, environment, support system that not only hold the clues to your root causes, but also how you need to move forward. All body systems are connected, which is why you need to know how to back it up and do that work to get the best result. You may be seeing a specialist that is only looking at and treating one body system. For example, if you're seeing a gastroenterologist, they may only be treating your gut and not taking into consideration how the adrenal glands and your diet may be influencing your gut, or how your gut is influencing your brain, and then know where to go with that information. If you're trying to do this on your own, you may not know how to progress yourself. So you may not be doing enough or trying to do too much at once. It's easy to get stuck and not know the next steps. There needs to be a methodical approach with someone that's overseeing everything. In other words, someone who knows how to tie everything together and make those connections between all the body systems with your nutrition and lifestyle. As functional medicine and nutrition practitioners, we're looking to address and heal the roots of the disease or symptoms. As we address the roots, we also want to assess and address the terrain or the soil where the root problem lies. If you see a plant with withered or diseased leaves, do you just clip the leaves or do you take a look at the roots and the soil? Just as the soil is important to the health of the plant, then when we balance your inner and outer terrain, we allow a shift to take place and remove the obstacles getting in the way of your healing. Here we're talking about nutrition, with how well you're sleeping, moving, managing stress, and hydrating. We're also looking at things like toxins in your environment, spiritual health, your relationships, and community support. So how do we help people with chronic symptoms? Our process always begins with a free 20-minute exploratory health discovery call. Here we explore specific questions to make sure you're the right fit for our programs and that you're going to be able to follow through because you've got the right support, you're in the right environment, and the situation at this time is right for you. We look at your readiness to start, and if right now isn't the right time, that's totally okay. Now, once we determine if we're a good fit for each other, we start with our foundational initial consult package. Our program begins with an initial case review where we sit down and go over your intake form, and this is about 90 minutes to a 2-hour appointment. We do an in-depth review of all areas of your health, from what you're eating to how you're sleeping, moving, and even how well you're eliminating. At this appointment, you may be asked to fill out a food journal to review the next time that we meet. Specialty functional testing, such as hormone or gut testing, is typically not something we recommend right away unless there is a good indication for it. There's generally much cleanup work to do with the diet and lifestyle first before assessing the need for testing. Deeper testing is always a decision we make together as we consider where we are in the treatment process. The follow-up appointments in the initial package focus on clearing the obstacles to healing. We call this clearing the muddy waters. During this time, we focus on bringing inflammation down in the body to get a better understanding of where the roots of the illness are. We work on everything to start optimizing your health, including nutrition, lifestyle, so that's your sleep, how you're managing stress, what you're doing for exercise, what's in your environment, and what are your behaviors and mindset. We review your food journals to see where symptoms are occurring and where we need to take some change in your program. We review any of your standard blood work and current supplements to see where we may bring deficiency to sufficiency. You'll receive written action plans at each appointment. The initial consultation package gives us the traction we need to move forward, and most people will already be seeing results in this time. You may then opt for continued treatment with our follow-up packages, which builds on the progress made in the initial and provides momentum to keep moving forward. This allows us to go deeper into a particular area, create more behavioral change, and do functional testing if necessary. Throughout your journey, you have access to me between appointments via a secure patient portal so that you feel fully supported throughout your time with me. You'll also have access to an online pharmacy with pharmaceutical-grade supplements. All right, so let's go over some frequently asked questions. Does health insurance cover these visits? Most health insurance companies do not cover health coaching. However, some flexible spending account plans may allow for reimbursement. As far as functional testing, most insurance companies do not cover the testing, but we are judicious in recommending functional testing, and we try to get the best direct lab pricing. So what if you've tried everything? How will this method be different? When people come to me saying they've tried everything and they didn't have success, it's usually because something was missed, either in the history or in the treatment application, because everything is connected and everything you do matters. Just like in the last case I presented, we find the missing link. We look under every rock to make sure nothing has been missed that needs to be addressed. We use objective and subjective data to craft a strategic game plan to address underlying imbalances and the root cause of your health issues. We start working on the terrain to facilitate healing and lasting change rather than spend time and money just trying to suppress symptoms. How long does it take to heal? Well, this varies from person to person, and it depends on the complexity, length of time with the illness, and compliance with the program. As a bonus, when we take a patient through our program with all the coaching and guidance that you get, your family's health will improve as well. What's the investment? Our packages run anywhere from $700 to $4,000. You may be asking yourself, can I afford this? But how much does it cost in medical bills and time lost from work treating chronic illness that doesn't get you the result? Or how much does it cost to continue to try to figure this out yourself without a clear understanding of what's going on and how to methodically address your issues? What's the cost of missing time from your life? What's the value of feeling heard and understood? Is this right for me? The answer is probably yes, if you're committed to up-leveling your health to thrive and not just survive, if your routine blood work comes back normal, but you still don't feel right, if you want to feel heard and understood, if you're looking for clarity and answers to long-standing issues, if you're at the point where you want to investigate this further, then we're happy to get you on a no-cost, no-obligation call to explore what your options are to live a life that's vital. So here are your next steps. Just click the button below or go to annlemonswellness.com to schedule your complimentary 20-minute discovery call. Once you've reserved your appointment, you'll receive a short questionnaire so we can maximize our time together. That way, we can review your basic information and together decide if it's a good fit for you. Then we'll call you during your scheduled time at the phone number you've provided, and that's it. So thank you all for spending this time with me today. I'm excited to help you move forward in your health journey to access your self-healing potential to not just survive, but thrive and live your best life.